Hi there, my name is Imogen and this is my video for the Introduction to Veterinary Physiotherapy assignment. When discussing canine handling, it is important that we have good knowledge and understanding of the best and most safe practices. The most important advice for a handler of how to behave around an animal that you're treating is to remain calm, because this is going to keep the animal relaxed. If the animal is relaxed, they're going to be much more easy to treat, more receptive to the treatment, and less likely to become tense or aggressive, which is important for the safety of both you and the handler. It is also important that no sudden movements are made by either yourself, the therapist, or by the handler, as this is going to startle the animal. Another important aspect for consideration when advising the handler of how to behave around the animal is the collar or harness that they have on the animal. You want something that is going to keep the dog under control but is not going to be restrictive of the practice that you're trying to do on them. It is also good advice to practice putting the animal in lateral competency prior to you coming and treating them for the first time. This means that when the dogs are put in a slightly more unnatural position, it's something that they're going to be used to and therefore won't be so worried by. As a therapist, it is important to consider the positives and negatives of the area in which you're treating your dog. The area that I've set out for the dogs today has both positive and negative aspects to it. Firstly, this area is within the dog's home environment, and therefore, as you can see, it is a space in which they feel very comfortable. Secondly, there are no open doors or windows from which the dogs can escape. And thirdly, the mat that we have laid out on the floor for them is comfortable, which means that they will feel more comfortable during their treatment. Some negatives of this space include the fact that the mat is not fixed, and therefore the dogs could slip on this mat if they were to move suddenly on it. There is also a lot of other things within the room, such as furniture, books and shelves, which from a safety perspective is not ideal for the dogs. And lastly, as it is a home environment, there are lots of other distractions for the dogs. So to make improvements on this space, we want a clear room with a soft, padded, non-slip floor to treat the dogs on. We also want a quiet room with very few distractions that will keep the dogs in a very calm environment. And you want the room to be warm or heated, but not too warm that the dogs are going to feel uncomfortable during their treatment. Hygiene for both yourself as a therapist and for the handler are very important to consider when treating animals. There are several methods that you can use to keep yourself clean, such as an antibacterial hand gel, which is easy to apply when on the move. We also have other options such as an antibacterial hand soap to wash your hands with very hot water that's going to keep them free of germs. Another consideration is to change your clothes between the animals that you're treating so that you can ensure that you're not going to be spreading anything at all. And a final note for consideration of hygiene is to check that your dog is up to date and has had all their vaccinations prior to meeting them for the first time, and also to check if they have any clinical history that would involve the spread of infectious diseases. Dealing with aggression is something that invariably no physiotherapist wants to have to do, but it will likely happen within their career. It is important to remember that when a dog becomes aggressive, the safety of both yourself, the therapist, and the handler are the most important aspect of all, and no one wants to be bitten. Some tips that you can use for aggressive dogs is to put a muzzle on them, which will prevent them from being able to bite anyone. If the dog does become aggressive, the best thing you can do is back away and give them some space. When treating an animal who is in pain, it is important to remember to make the changes in their routine gradually, and the changes in their treatment. It's unlikely that you're going to be able to solve all their issues in one session, and therefore by moving gradually through your treatment program, you are going to be able to lessen the pain of the animal for the long run, but also you are less likely to inflict a pain response in them which may cause them to become aggressive. And remember, if the animal does appear to be in significant and untreatable pain, it is your responsibility to make sure that they are referred to a vet. Good boy. Good boy. Good boy. Lay down. And roll over. Good boy.
TMJ. Wings of Atlas. Dorsal spinous process of cervical, thoracic and lumbar vertebrae. Tuba sacrale.
Yep.
Tuba coxae. Tuba ischiae. Greater trochanter at the head of the femur. Lateral condyle of the femur. Medial malleolus of the tibia. Cranial part of the greater tuberosity of humerus. Deltoid tuberosity. Scapular spine. Acromion process of scapula. Calcaneal tuberosity. Patella. Olecranon. And accessory carpal bone.
The masseter.
The masseter raises the mandible.
The trapezius.
Good boy. The cervical portion of the trapezius draws the scapula craniodorsally. The thoracic portion of the trapezius draws the scapula caudodorsally.
The clidocervicalis.
The clidocervicalis protracts the forelimb and laterally flexes the head and neck.
The rhomboideus.
The rhomboideus fixates the thoracic limb and draws the scapula craniodorsally.
The omotransversarius.
The omotransversarius protracts the forelimb and laterally bends the neck.
Serratus ventralis.
The serratus ventralis supports the trunk, raises the neck, and has an auxiliary function in inspiration.
Supraspinatus.
The supraspinatus extends and stabilizes the shoulders.
Infraspinatus.
The infraspinatus flexes and abducts the shoulder.
The superficial
The
pectorals.
superficial pectorals abduct, protract, and retract the forelimb and are the trunk limb attachment.
The triceps brachii.
Triceps brachii extends the elbow and the long head flexes the shoulder.
The biceps brachii.
Biceps brachii flexes the elbow.
The deltoideus.
The deltoideus flexes the shoulder.
The latissimus dorsi.
The latissimus dorsi retracts the forelimb, flexes the shoulder, and draws the trunk forward when the forelimbs are fixed.
The longissimus dorsi.
The longissimus dorsi stabilizes and extends the vertebral column, elevates the head and neck, and naturally flexes the trunk and neck.
The iliocostalis.
The iliocostalis draws the ribs caudally for expiration, fixes the lumbar vertebrae and ribs, and extends and laterally bends the vertebral column.
The gluteus medius.
The gluteus medius extends the hip, retracts and adducts the hind limb.
The biceps femoris.
The biceps femoris, when weight bearing, extends the hip, stifle and tarsus. When non-weight bearing, they flex the stifle.
The semitendinosus.
The semitendinosus, when weight bearing, extends hip, stifle and tarsus, and when non-weight bearing, flexes the stifle and adducts and pronates the hind limb. Semimembranosus extends the hip, stifle and tarsus. When non-weight bearing, extends the stifle, adducts and pronates the hind limb.
The vastus lateralis.
The vastus lateralis extends the stifle and fixes the limb.
The gracilis.
The gracilis adducts the hind limb and extends the tarsus.
The pectineus.
The pectineus adducts the hind limb and flexes the hip.
The gastrocnemius.
Gastrocnemius extends the tarsus and flexes the stifle.
The iliopsoas.
The iliopsoas flexes and supinates the hips and protracts the hind limb when extended. When handling large animals, there are many precautions we need to take into consideration to ensure that both ourselves as therapists are safe and also to ensure the safety of our handlers. Our first and crucial aspect of personal safety is to make sure that you're wearing a hat which is to the current British specifications as set out by the British Horse Society, and also to be signified by the kite mark inside the hat. A second consideration is to be wearing gloves, which are preferably made of a tough material such as leather gloves. These are going to protect your hands if the horse pulls away suddenly and also provide you with more control and grip. Another key aspect of personal safety is to be wearing boots, which are made of a sturdy material, again, such as leather, which are going to protect the feet if the horse does decide to stand on your toes. And to make that even safer, you can use boots with a steel toe cap, which will not be crushed under the horse's weight. However, the most important aspect of all in your own personal safety is your behaviour around the horses. This includes being alert and monitoring the horse at all times and keeping an eye on their behaviour and their reaction towards you. If you show a horse becoming aggressive, for example, flattening their ears, swishing their tail or backing up towards you, you know that you've probably overstepped the mark and therefore need to move away as quickly as possible to prevent them from becoming further upset. Additionally, when moving around a horse, you always need to be cautious of areas where you are more at risk, for example, standing behind the horse or in front of the horse where you may be kicked or bitten. The hygiene considerations for both canine and equine are fairly similar. For example, we can use antibacterial hand sanitizer or an antibacterial soap to keep our hands clean between each client. Hand washing is particularly important in horses as they tend to be a little bit dirtier, and therefore, as therapists, we end up with a little bit more grease on our hands, which must be removed prior to seeing the next customer. Changing clothes between each horse is also good practice to prevent the spread of diseases. And as with the canine, checking that the animal you're treating has had all its vaccinations is crucial to prevent the spread of disease. Before assessing an animal for the first time, it is important to watch them in their own natural environment. While watching them, you're looking for things such as signals of pain and how they respond to you being in their presence. When observing an animal for the first time, it is important to look at them both statically and dynamically. When looking at an animal statically, we're looking for their overall balance as to whether or not they're uphill or downhill, and the body proportion, so whether the neck, abdomen and hindquarters are in proportion to each other. Another key factor we look for is symmetry. This is particularly crucial in the musculature, as we look to see the story that the horse's body is telling us. It is important to look for regions of atrophy and hypertrophy on the muscles and to see whether or not they are symmetrical on both sides of the body. By assessing muscle symmetry, we're going to be able to pinpoint areas of developmental weakness within the horse and try and help improve performance by targeting these weaker areas. Another consideration for static assessment is to look at the loading of the horse. We want to see whether or not they shift their weight over to one side of the body or the other, or whether they tend to put more weight on the forelimbs or the hind limbs. The offloading pattern of the horse may give us more of a clue as to where an area of weakness is, and if this can be addressed soon, it may help to prevent an issue from developing in the future. Moving on to dynamic assessment, we tend to look at the horse in walk, trot, rein back and occasionally canter. The dynamic assessment completes the overall picture that we have already formed of our horse. We often tend to start in the walk, as this can highlight subtle dysfunctions which may not be apparent in the faster gaits. The overall goal when assessing dynamically is to see if we can detect a lameness in the horse. If a lameness is detected and it has not already been diagnosed by a vet, then this animal unfortunately does need to be referred back and seek veterinary help. There are some important things to consider when assessing dynamically. Things such as foot placement, where we need to ask ourselves, is it even bilaterally? Another thing to consider when looking at the limbs is to consider the angle of the joints and the flight arc of the hoof through the air, or if one isn't present, look at whether or not a toe drag is present in the horse. When looking at the hindquarters, we need to consider the symmetry of the pelvic swing as the horse takes a step, and also the symmetry of the recruitment of the hindquarter muscles. When looking in the cranial aspect, we want to consider the head carriage of the horse, whether this be high or low, and whether or not we can see head nodding, which may indicate forelimb lameness. It is important to consider the best area to be treating your horse, and there are many environments which may be suitable. For example, the stable that I'm in right now could be an excellent place to treat a horse. The floor is fully rubber matted with grips, as are the walls, and the space is light, airy, well ventilated and secure. Therefore, the horse is going to feel safe and is also not going to be slipping around or feeling unstable whilst being treated. It is also an excellent place to treat our horses, as it is their home environment and a place where they will feel safe and comfortable. The yard environment, where I will be palpating and examining Bruno, is potentially a good environment. However, as it is a cobbled yard, the floor which he is standing on is going to be uneven, and therefore he is never going to be truly stood up square, which is going to make it hard to treat him and assess him. If the yard were smooth concrete, then it could be a great place to treat, as he would have a level place to stand on. Many therapists like to treat horses under a solarium, which is an excellent tool to have, as it keeps the horse's back muscles warm during the treatment, which will make them looser and more easy and more supple to treat. So I'm here with Bruno, and I'm going to be picking out a front and back hoof. Boy. So I'm now going to fit Bruno's bridle to him. Bruno wears a standard Cavesson bridle with a ported mouth, straight bar egg butt snaffle. He also has an anatomical headpiece cut back to give more room around the ears. To fit it, I'm going to do so by holding the bit up near the corners of his mouth and holding the headpiece up behind the ears. As I'm comfortable that that's going to fit him, place the reins over his head, undo the lead rope, put the head collar around his neck, and put the bridle on his head. Then secure the throat lash and the noseband. This is me presenting Bruno square for examination. Cool. Good boy. And go back. Go back. Go back. Good boy. Walk on. Walk on. Good boy. Right, okay. And do it. Do it. I wanted to include this video of me walking and trotting Bruno up on the road as well, as I feel it's important to raise the point that vets like to use both soft and hard surfaces to see the way that the different forces act upon the legs. The hard surface obviously is going to provide a more concussive force, which may be able to detect different types of lameness more easily.
Temporomandibular joints. Wings of the atlas. Transverse processes of C3, C4, C5. Dorsal processes of Withers area. Tuba sacrale. Tuba coxae. Tuba ischii. Cranial part of the greater trochanter at the head of the femur. Lateral condyle of femur. Lateral malleolus of tibia. Cranial part of greater tuberosity of humerus. Scapular spine. Deltoid tuberosity. Lateral epicondyle of humerus. Patella. Accessory carpal bone.
Alright, good boy.
calcaneal tuberosity. Superficial digital flexor tendon. Deep digital flexor tendon. Suspensory ligament. Annular ligament. Common extensor. Lateral cartilages. Lateral extensor tendon. The masseter.
The masseter raises the mandible for mastication.
The rectus capitis dorsalis.
It elevates the head.
The obliquus capitis cranialis.
This extends the head or flexes it laterally.
The splenius.
Splenius extends, elevates head and neck laterally.
Trapezius.
The cervical portion of the trapezius draws the scapula craniodorsally. The thoracic portion draws the scapula chordodorsally.
The sternocephalicus.
Sternocephalicus opens the mouth and flexes or inclines the head and neck.
The rhomboideus.
The rhomboideus draws the scapula dorsally and cranially and elevates the neck.
The brachycephalicus.
Protracts the forelimb, flexes and turns the head.
The serratus.
Serratus ventralis suspends the trunk, raises the neck when the forelimb is fixed, and supports inspiration in the thoracic region.
The subclavius.
Subclavius suspends the trunk and stabilizes the shoulder.
The supraspinatus.
Supraspinatus extends and stabilizes the shoulder.
The infraspinatus.
Infraspinatus extends and flexes the shoulder and functions as a contractile lateral collateral ligament.
Superficial pectorals.
There are trunk limb attachment which adduct, protract and retract the forelimb.
The triceps brachii.
The triceps brachii extend the elbow and the long head flexes the shoulder.
The biceps brachii.
The biceps brachii extend the shoulder, flex the elbow and stabilize the carpus.
The deltoideus.
The deltoideus flexes the shoulder.
The latissimus dorsi.
The latissimus dorsi retracts forelimb, flexes the shoulder, and where the limb is fixed, it draws the trunk cranially.
The iliocostalis.
Iliocostalis stabilizes the lumbar vertebrae and ribs and bends the vertebral column laterally.
The longissimus dorsi.
The longissimus dorsi stabilizes and extends the vertebral column and elevates head and neck laterally.
The tensor fascia lata.
Tensor fascia lata flexes hip, protracts hind limb and extends the stifle and tenses the fascia lata. Oh boy.
The gluteus medius.
Gluteus medius extends the hip and abducts the hind limb.
The biceps femoris.
quadriceps femoris extends the stifle, flexes the stifle when non-weight bearing, and extends the hock joint.
The semitendinosus.
When weight bearing, extends the hip, stifle and tarsus when weight bearing, and when non-weight bearing flexes the stifle.
Semimembranosus.
When weight bearing, extends the hip and stifle. When non-weight bearing, it retracts, abducts, and inwardly rotates the hind limb.
The vastus lateralis.
The vastus lateralis extends and stabilizes the stifle.
And the gastrocnemius.
The gastrocnemius extends the hock and flexes the stifle.